So we know that home care, as Jane said earlier, is a high-risk area. All healthcare to some degree is high-risk care. But there is a potential there to be human rights as a core feature when care is provided behind closed doors in people's homes, and in many ways that is greater than those in institutional settings. Now the reason for that is that there is that intricate combination, as there is in residential care services, that there's basic and advanced healthcare needs, but you are providing them in a setting that has not been designed for the delivery of healthcare. So at any stage when your staff members are heading out, they really don't know the settings that they're going to have to provide care in. So that in itself has fundamental risks to the service that's being provided. So there is a very different set of risk factors. Now I know members of the delegation today have a lot of experience in residential care and hopefully will carry those through into the home care sector. But however, it is important to note that there are intrinsic differences in the way that the service will have to be provided in home care over residential care services. But that doesn't mean that it isn't in a position to give us good guidance in relation to what we're facing going forward. The Canadian Institute in 2013 completed a review actually of a vast number of care records from home care. And what they found in relation to it, that the risk areas was inconsistencies in the way care is planned and delivered. Okay, that was primarily one of the key risks. Second of all, there was a lack of integration in the home care teams, a lack of coordination across the home care sectors, and failures in communication. Poor standardization of processes, documentation, equipment, and packaging in medication. And clients and caregivers were sometimes required to make decisions that put the health of the service users at risk. Now, in any of those situations, we could have looked back in the residential care sector back in 2008 and said all of those applied. But again, without the support or the model that they're on the premises with additional care workers and supports. So again, those risks will be foremost to HCI's considerations as they look forward to the regulation of the area. Obviously, the risk of abuse is high, and we have some comments here that came back from the Equality and Human Rights Commission, where obviously the key factor, lone workers providing care in the service users. So we can see that there could be potential for areas of neglect. There's a lack of autonomy and choice, and key to that, the lack of respect for privacy and dignity. And privacy and dignity continues to be one of the key focuses for HCI's regulation in the residential care services. And we'll look at some of the results that are still coming out from residential care, where they're continuing to find weaknesses in that area in relation to putting the resident, the service user at the centre of care, and demanding that they're given autonomy and that their rights are respected. Obviously, there are key challenges also to our staff. You can see here another quote that came: the least satisfying element is not having enough time. And Jane has spoken about that. You try not to hurry them, but you're aware that your next client is waiting and that you're on the clock. And again, you know, you never know what you're going to face as a service provider entering into somebody's home. But you know, that has to be clicking at the back of your head. Your next appointment is waiting, and you don't have the flexibility in being able to provide the care. From a more clinical perspective, the British Medical Journal identified the top 5 key risk factors being falls, medication errors, psychosocial issues, behavioural and mental health problems, and wound infections. So they were the key 5 clinical aspects that they considered. And again, looking for how are we going to address these from an evidence-based perspective and put the protocols and care plans in place to be able to identify preventative measures. And just briefly, from research again, this is from the Canadian Institute. Of their research, 17% of hospital patients experience an adverse event, but when they reviewed the home care records, they identified a reported rate of 13%, with 1/3 of those were deemed preventable. And that was from the reportable. But when they completed their review, they found that up to 66.5% actually had findings in the records that they would have deemed to be an adverse incident or a near miss.